Hi, folks. Let's talk about our evidence-based practice. My topic is sensitivity and specificity. So, what is the sensitivity and specificity? So, based on the definition, the sensitivity and specificity are statistical measures of the performance of a binary classification test that are widely used in medicine and healthcare. So you may know about a little bit about this, but we're gonna talk a little more for today's topic. So before we start to talk about sensitivity and specificity, so I want to introduce the four terms that we're going to use for describing or explain those two terms. So the first one is true positive. So the definition here is that the clinical test and golden standard are both positive, condition is correctly identified. So for example, if you perform a special test. So let's see the anterior drawer, so which is the special test for the ACL tear. We're gonna talk a little bit more afterwards. So we just take this as an example. So if you do the anterior drawer test and you believe that this is a positive, and then the patient do either the X-ray or the MRI showed the positive. So they both are positive and the condition is correctly identified. So for this circumstance, we see that's a true positive. So move on. The false positive, it means the clinical test incorrectly identifies condition as present when actually there's no pathology. So we still use the anterior drawer test as the example. So if you believe the patient had ACL tear after you use the anterior drawer test, but the patient go to the MRI, the images show that the patient do not have ACL tear. So during that time, for that circumstance, we're gonna say that's a false positive. You fails to identify the injury or the pathology. So move on, we can easily understand the true negative and the false negative. So what is the sensitivity? So the sensitivity is also known as true positive rates, and it's a way to measure the proportion of true positives that are correctly identified. So, so the example here, the proportion of those who truly have a condition affected were correctly identified as having some condition. And also another explanation for this is the measurement that determines test ability to detect those patients who actually have the disorder relative to the gold standard. So remember that, okay, that's true positive rate. So move back to the last lecture, the true positive. We both, the gold standard and your test, you both find the true positive, the positive of the condition. So true positive sensitivity. Let's move on. So how we get the sensitivity? So there is a formula here. We can see the sensitivity equal number of the true positives divided by number of true positives plus number of false negatives. So that's the formula to calculate what is sensitivity. So explains the positive result identified relative to the total number of the positives. So true positives plus false negative. So when we use the sensitivity, we should remember that they can identify all or most all patients with a given condition. So snout, we call that sensitivity rule out the condition. So the rest of them gonna be the patient who have the pathology. So snout, sensitivity rule out the condition. All right, so what is specificity? So also known as true negative rate. So let's go back. Sensitivity, true positive rate. Specificity, true negative rate. So the explanation here, specificity measures the proportion of true negatives and the proportion of those who truly do not have the condition, who are correctly identified as not having the condition. And this is a measurement to determine and describe the clinical test ability to identify patients that do not have the disorder relative to the gold standard. So how can we get the specificity? So explains here the negative results identified relative to total number of positives. So that is the true negative plus false positive. So use this formula so we can get the specificity. Okay, so here spin in, so good at ruling in this condition. So specificity, spin in, specificity, rule in the condition. Okay, so now we understood what is the sensitivity and specificity and how can we use in the clinical practice and what is number means. So we use that formula, we can get a number. So what is the number means? And also what is the good sensitivity and what good specificity? Okay, so let's, as we talk about the anterior drawer test, and also I want to introduce a Lachman's test and pulse shift test. So all these three tests we can use to identify if the patient have the ACL tear. So we use these three tests as the example. So anterior drawer test, we can see the sensitivity here is 0.6. Specificity is 0.85, okay? And then next one, the Lachman test sensitivity is 0.87, specificity 0.96. And the next one, pulse shift, okay? The sensitivity is specificity. And if we summarize all this together, we can easily see that the Lachman test have the highest number of sensitivity and specificity compared with the pulse shift anterior drawer. So even though the pulse shift has 0.96, the same like the Lachman, but the sensitivity is a little bit lower. So what's the meaning for that? So we can see the higher number of the sensitivity and specificity, the more reliable of the test. So when you go back to think about the formula for how to calculate the sensitivity and specificity, you will see that the higher number of this, the more reliable of the test. So, and also we can see this test have very high number of the numbers very high for the specificity. So that means it's very good test to rule out the pathology. But the anterior drawer only have 0.6 and 0.6 right here. Still, it's like looks good, but compared with the Lachman, it's a little bit lower than that. So the number of 70% and higher is considered the good sensitivity of specificity. That's how we use this number. Okay, if you want to use a test, so firstly you want to say, okay, if the test have the good sensitivity or specificity rate, if higher than 0.7, we consider, okay, that's a good test. So compare these three, or even you compare more tests, more special tests, you can find that a lot of special tests, they have very high number of the specificity, but some of the tests, they have very low number of the sensitivity. So that's meaning the most of the tests, if you use that test, you can rule out the condition. Okay, but sometimes some of the tests, they can't really help you to rule in the condition. If the number get 1.0 or 100%, what's the meaning for that? That means no false. So we can call that gold standard. So that's 100% rule in and or rule out the pathology. So I hope this explanation can help you understand sensitivity and specificity and also help with your clinical practice. All right, thanks for watching it as a reference.